Taking a little break from recipes to talk about something near and dear to my heart, Dr. Bhattacharjee is here from the Neuroscience Group in Nina to talk about scoliosis. Good morning.
Morning. How are you?
I'm good. Nice to meet you. And that's something that I actually have and grew up with and was at the doctor many times. Luckily, in my case, it turned out to be fine.
Right.
But it's something that, well, first of all, what is scoliosis, doctor?
Scoliosis essentially is a curvature of the spine. You know, over time with research we understand it's a more of a three-dimensional problem where the spine sort of twists over a period of time. So it's a progressive problem that happens over years.
Very common, though, and I know that there are lots of different types of scoliosis.
Right. I think, the one we are most familiar with kids, in the adolescent group, when they go to middle school, we start seeing the curvature. That's the one we are familiar with. But adult population tend to have a huge number of scoliosis, which is very different from the pediatric population that we know of more often.
Now that's where you guys come in because you have so many different treatments for many different things, but
Sure.
for this in particular, what are some of the treatment options, surgical and non-surgical?
Right. I think, again, due to the different kinds in the pediatric population to start with, we try to watch them initially, and if it progresses, then we try to brace them, and if that all fails, that's when surgery comes into play. Kids usually don't have too much problem with pain and discomfort, but they can have that where therapy and other issues come into play. In the adult population, which is more of a degenerative problem, which is a wear and tear issue that happens over years, that can lead to more physical therapy, at times bracing, but sometimes surgery is essential because of weakness, so much pain and discomfort the patient may suffer from.
But boy, you can do some amazing things, I'm sure.
Sure. I mean, nowadays, actually, the recent research data is suggesting that the treatments, the surgical treatment, even though they look scary, tend to have very good results long term, and patients are very happy and their quality of life improves substantially. And it affects their heart, lung, and other functional status too significantly.
Now, we talked a little bit about scoliosis. What are some of the other things that you do, and what makes your group special and different from others?
Right, and as I spoke, like the scoliosis, they're just not about surgery. So there are other aspects of it, managing their pain, their neurological issues. So we have a group of neurosurgeons, orthopedic spine surgeon, neurologists, and pain doctors and physiatrists that help us manage these complex patients.
And for people who are sitting at home wondering about you guys, how can they find out more?
Right, sure. They can call us at the Neuroscience Group or look us up at the website, www.neurosciencegroup.com. That is the best way to get in touch with us, or, just look up my name online and able to contact us that way.
Doctor, for people who, aren't sure if, especially parents, aren't sure if their children have scoliosis, what's the age to look for that? And how should they, find it? Or how do you find out if one has it or not? Especially, I know it's very common, especially in girls.
Right, exactly. And, the ratio from girls to boys is 1 to 6. Pediatricians are very good and astute at picking these things up, but, it can be mixed. One of the things we have to understand, smaller scoliosis is not a problem. Like yourself, you had scoliosis, really didn't come to anything, and that's most of the time what it is. So it's not a scary problem, but it's something we need to keep an eye on. So asking your pediatricians about, if there's a need to do, and some simple tests like a simple X-ray can reveal all these findings.
And hereditary. I know it's very, my daughter, we definitely had her checked for that early on, just
Sure.
to keep an eye out for it.
Yeah, and there's a genetic component. We actually have, at a brief time, we used to do a genetic test. It was not reliable, but it does tell us that genetics play a huge role in young kids to have scoliosis.
All right, doctor, thank you so much. The Neuroscience Group in Nina, if you've got questions about scoliosis, and they do many, many other things as well, comprehensive approach to brain, spinal, and pain care, surgical and non-surgical, get a hold of them. And again, the website?
www.neurosciencegroup.com.
Thanks so much. Appreciate it.
Great. Nice to meet you.
You too.